Trachoma. Trachoma, infection of the eye, was the most important cause of blindness in India in the 1950s, and over 50% of population was affected in Gujarat, Rajasthan, Punjab and Uttar Pradesh. Trachoma disease was the most important cause of corneal blindness in India, affecting young children. Trachoma is an infectious disease caused by bacterium Chlamydia trachomatis. It is a chronic infectious disease of eye and is the leading cause of infectious blindness globally. It is the outcome of inadequate access to water and sanitation and poor personal and environmental hygiene. Trachoma directly affects the conjunctiva under the eyelids. The inner surface of eyelids are roughened due to infection. The infection causes inflamed granulation on the inner surface of lids. Roughening could lead to pain in the eyes and breakdown of outer surface of cornea, eventually leading to blindness. Repeated trachoma infection could lead to permanent blindness as the eyelids turn inwards. Trachoma. Trachoma is an eye disease caused by infection with bacterium Chlamydia trachomatis. Based on data of March 2019, 142 million people are at risk of trachoma blindness as they live in trachoma endemic areas. In 2018, global level antibiotic coverage for trachoma was 50%. About 146,112 people received surgical treatment for advanced stage and 89.1 million people were treated with antibiotics. Trachoma is responsible for visual impairment and blindness of about 1.9 billion of the population. Trachoma disease is a public health problem in 44 countries. Blindness resulting from trachoma disease is irreversible. Infection of trachoma spreads over personal contact via beddings, hand or cloth, and by flies that have been in contact with an infected person. With repeated episodes of infection over the years, the eyelashes may be drawn in so that they rub on eye surface with pain and discomfort, causing permanent damage to the cornea. In 1998, the World Health Assembly adopted the resolution WHA 51.11 targeting the global elimination of trachoma as a public health problem. The elimination strategy for trachoma is summarized by the acronym SAFE, meaning surgery for advanced disease, A for antibiotic to clear Chlamydia trachomatis infection, F for facial cleanliness, E for environmental improvement to reduce the transmission. Trachoma symptoms and signs. The symptoms of trachoma include eye irritation with tearing, light sensitivity, pain and vision loss. The signs include redness, presence of follicles, corneal opacity, scarring as described in the stages of trachoma. Stages of trachoma. The World Health Organization WHO grading system classifies trachoma disease in 5 stages. Follicular stage, also called TF stage, that is trachomatous inflammation. This mostly requires topical treatment. Then intense phase TI. At this stage, topical and systemic treatment are considered. Then trachomatous scarring TS. TS is the state when the scars are visible in the tarsal conjunctiva and which may obscure the tarsal blood vessels. Then trachomatous trichiasis. When the affected person is referred for eyelid surgery, it is the TT stage. Then corneal opacity is the stage when the affected person is irreversibly blind. Treatment for trachoma, control and prevention. As reported by WHO, the number of people at risk of trachoma disease has fallen to 142 million in 2019, which was 1.5 billion in 2002. The WHO Alliance for GET 2020, that is Global Elimination of Trachoma by 2020, aims to eradicate trachoma completely through implementation of SAFE strategy, which is a multifaceted strategy to prevent and treat trachoma disease. SAFE is S is equal to surgery to correct internal eyelids and trichiasis. A for antibiotics, azithromycin to treat active infection. F for facial cleanliness to reduce human transmission. E for environmental improvement to reduce human transmission like access to the clean water, hygiene measures to reduce the fly population. The antibiotic treatment for active trachoma disease is one-time use of Zithromax, that is azithromycin pills. However, reinfection is common if a person doesn't take improvement in hygiene and access to clean water. Surgery is necessary to correct the lid position when the infection has progressed to the inward interning of the lashes. Sight restoration can be done through corneal transplantation surgery if corneal scarring develops significantly. Various government agencies and INGDOs, that is International Non-Governmental Developmental Organization, such as Carter Center Trachoma Control Program, work together to implement the SAFE strategy. Trachoma disease morbidity. Active trachoma, that is inflammation trachoma, is common among children of preschool age with prevalence rate as high as 60 to 90%. Women are infected and blinded 2 to 3 times more often than men because of greater frequency of infection episode, probably due to their close contact with infected children. Environmental risk factors influencing trachoma disease transmission include inadequate sanitation facilities, shortage of water, poor hygiene, and crowded households. India free from trachoma. The National Trachoma Survey report surveyed active trachoma among children and declared India free from trachoma. It showed overall prevalence of 0.7% only, which is much below the elimination criteria of infective trachoma as defined by WHO. Active trachoma is considered eliminated if the prevalence of active infection is less than 5% among children below 10 years. It was stated by Union Health Minister that survey results indicate that active trachoma is no longer a public health problem in India. India has met the global trachoma elimination as specified by the WHO under its Global Elimination of Trachoma by year 2020, that is GET 2020 program. This has been possible due to decades of intersectoral intervention and efforts that include provision of antibiotic eye drops, availability of safe water, availability of surgical facilities for chronic trachoma, personal hygiene, improved environmental sanitation, and general improvement in socio-economic status in the country.